Hello, I'm Dr. Michael Carroll. If you are one of the 48 million shoulder pain sufferers in the United States, you need to listen to this commercial. The shoulder is a remarkable joint, allowing for a 270-degree range of motion. When the shoulder becomes dysfunctional and painful, there are a few aspects to your life that are not affected. Listen to some typical shoulder pain symptoms.
It was affecting my sleep, and it was affecting playing, like I said, playing with my son, playing football and baseball in the backyard. And it was uncomfortable.
My whole body was limping.
And I was always waking up with pain or having to adjust myself.
I could not lift my arm above my head. It was that much pain.
If these patients are similar to you, then you will be happy to know that we have developed a solution. To understand why the RotatoReliever is such a remarkable treatment for the shoulder, you must first understand what is wrong with your shoulder. The rotator cuff is a set of 4 muscles that basically keep the ball of the humerus in the socket of the shoulder blade. Problems begin for the rotator cuff when the supraspinatus tendon is pinched between 2 hard objects, the humerus and the coracoacromial ligament. This pinch robs the tendon and muscle of blood and nutrients and causes rapid degeneration of the tendon. During the day, the weight of the arm acts as traction that opens the space. At night, that traction is lost, causing the arm to migrate superiorly, causing the pinch or impingement. Think about this. You are injuring the shoulder during rest, just when the body should be rejuvenating. This is why your problem has been so difficult to treat. All the good things you do for your shoulder during the day are negated by the nighttime impingement that is robbing the rotator cuff of blood, oxygen, and nutrients it desperately needs. Our solution to this daily cycle that destroys your rotator cuff is to treat day and night. We tested our treatment plan and achieved dramatic results. 100% of patients treated by the RotatoReliever got better versus only 47% treated the usual way. In our world, this was a home run. The results of our study showed statistical significance. This basically means that it worked really well. We were able to publish the results and present them at the American College of Sports Medicine National Meeting. Let me show you how our system works. The nighttime component places a specific amount of traction on the arm and is to be worn for 40 nights. This decompresses the rotator cuff, preventing injury and allowing blood flow for healing. The daytime exercise component utilizes a strategy of dynamic stabilization and isolates the rotator cuff. Too many attempts to strengthen the rotator cuff end up strengthening the overlying musculature of the pectoralis, trapezius, and deltoid muscle groups. High repetition centripetal forces exercise the entire rotator cuff. This serves to tone the other 3 muscles of the rotator cuff and further prevent impingement on the supraspinatus, or top of the rotator cuff. Our 40-day program of exercise with progressively weighted balls results in a toned and functioning rotator cuff. In addition to exercising the right muscles, our device gets this done in an efficient 5 minutes per day. Listen to what our night and day treatment system has done for these patients.
To me, RotatoReliever did 2 things. One, it helped my wife get better sleep at night, and it helped me play with my son out in the backyard, like catch again. So those are 2 things that, to me, was totally worth it.
After just a few nights of wearing the device, the pain had really begun to dissipate.
Now I was back to normal. I could move, I could rotate, I could do things with my arms.
And it got me back to a normal activity level.
It was painful, and I had to do something.
To get relief like that is worth anything.
The pain was gone.
We are confident we can help you, and that is why we have a money-back guarantee. Call 877-929-3390 and get your RotatoReliever today.